Everyone, thank you so much for joining us for today's Science Talk. We're delighted to have you here for this important session on the geography of invisible vulnerabilities, understanding the WASH health inequalities in place. My name is Dr. Miriam Axel, and I am delighted to be your host today. For those of you who are joining us for the first time, UNU-INWEH's weekly Science Talks feature the research of our researchers and affiliates, and they are all recorded. You can watch the entire 2024 series hosted by Professor Grace Oluwasanya, as well as the 2025 series on our website and our YouTube channel. That's unu.edu/INWEH/science-talks. Today's talk, like all of our others, will be recorded, and the recording will be made available after the session. Please also put your questions for the speaker in the Q&A, and we will have an interactive question and answer session where I will share your questions with the speaker. Feel free to put your questions in at any point. You don't need to wait till the end, and I will read them out to our speaker. And now I'm absolutely delighted to introduce my colleague, Dr. Abraham Nunbogu. Dr. Nunbogu is a health geographer who investigates how social and environmental factors influence health and well-being, with a special focus on the role of gender in shaping water, sanitation, and hygiene behaviors in the Global South. Dr. Nunbogu has extensive experience in policy-oriented research in Africa, Europe, and North America. And he actively collaborates with communities and policymakers in the Global South on a wide range of important issues like water security and health. And he's also served as a consultant on WASH and health promotion in Ghana. At UNU-INWEH, Dr. Nunbogu contributes to a wide variety of projects focusing on improving water, sanitation, and hygiene interventions, and he plays a key role in INWEH's Behavioral Adaptation for Water Security and Inclusion, BASIN project, which aims to understand how behavioral and psychological factors influence people's ability to adapt to water insecurity, particularly in regions of Africa vulnerable to climate change. Dr. Nunbogu completed his PhD in the Department of Geography and Environmental Management at the University of Waterloo, and his MSc at the University of Groningen in the Netherlands, and his bachelor's in development planning at KNUST in Ghana. And he did his postdoctoral research at the University of Waterloo, which was focused on water security and gender-based violence. And with that, I am delighted to turn it over to you, Dr. Nunbogu. Thank you so much.
Thank you, Miriam, for the generous introduction, and I'm so glad to be part of the INWEH family. Hello, everyone. Thank you for joining today. It's my pleasure to share with you some of the work I've been doing over the past couple of years. And today we'll look at the invisible geographies of WASH vulnerability. Here I look at the WASH gender health nexus, and this is part of a broader project I've done with Professor Susan Elliott and the Go Help Lab team at the University of Waterloo Geography Department. So yes, numbers don't lie. Let's look at this. We've been told that...
If you wanted to share your slides.
Oh, I've shared the slides. Okay, let me share again.
Okay.
Is it okay?
Perfect, yes, in presenter mode too. Thank you.
Okay, thank you. So yes, today I will share with you some of the work I've been doing over the past couple of years with Professor Susan Elliott at the Department of Geography, University of Waterloo. And our talk today will be on the invisible geographies of WASH vulnerabilities. Yes, numbers don't lie. We've been told that globally, about 16% of the population, that's households, do not have access to safely managed water. And by safely managed water, I mean you having good quality water in your home and getting it anytime you need it. And in 70% of these households, the responsibility for collecting water falls on women and girls. And we are also told that globally, women and girls spend about 250 million hours each day collecting water. And this most times limit their decisions to even have leisure or engage in income earning activities. And these disparities cast across space. In sub-Saharan Africa, women spend about 200 million hours every day collecting water. And these are numbers. Beyond these numbers are people's pain, their suffering, and sense of hopelessness. I know some of my family members and friends are counted as part of these figures. But the question is, now I'm in Canada, have I escaped being part of these figures? Maybe we'll get to know as the conversation progresses. So our world is unequal, where we are born, grow, work, and age shape our health and well-being. Yes, I'm a cisgender male of African descent. I was born and raised in the Upper West region in Ghana. And this region is socioeconomically vulnerable. And as a result of this socioeconomic vulnerability, I've experienced and witnessed different forms of inequalities, including wash and food insecurity and health access disparities. Yes, as a cisgender male, I was privileged because it wasn't my responsibility to provide water. But I still remember the number of times my sisters, Vinyorba and Sumbotumo, had to wake up at dawn to go to the borehole to fetch water for us to bath. And I still remember the day my sister, Kunyala, was run over by a snake. Yes, she wasn't bitten. This snake was chasing a frog, run over by a snake, and how my mom reacted. But I must admit that as a male, I only witnessed these experiences, but I didn't know how that feels being a woman at that time. So it is surprising that our recent conversations on WASH do not aptly capture some of these experiences. And because of my life experience, I always try to tell a complete story about people's experiences in terms of WASH. So in doing that, I adapted an integrated framework that will make visible some of these invisible vulnerabilities. And I draw from the feminist political ecology framework that looks at how gender plays a central role in determining access to resources such as water and how these resources are being used. However, this framework, though good, do not look at the health implications of some of the gendered vulnerabilities in terms of resource access. So I've also drawn from the political ecology of health framework, and this looks at how political institutions and maybe policy decisions cast across space to shape population health in place and time. But this framework is also limited because it does not look at the gendered implications of these health inequalities. So I have integrated these frameworks into a theoretical framework called Feminist Political Ecology of Health, which helps me to look at health inequalities at the individual, community, and how institutional policies or political decisions permeate to the micro scale, that's the individual and community level, to shape population health. And in using this framework, several research gaps remain. For example, there's still limited research that captures how wash systems reproduce gendered vulnerability across space, and the dimensions of what gender-based violence remain fragmented and under-theorized. Also, our framing of gender-based violence in public health is limited, and there's a need for a multi-scalar place-based understanding of how water insecurity intersects with gender. So in exploring or understanding some of these research gaps, I've used a multi-method approach, and this is one of our community sessions back in Ghana, where these communities were mapping out how they defecate and some interventions that could be taken. For this research or today's talk, I'll draw from a scoping review and interviews with some participants. So for the scoping review, I looked at database search from 4 databases, did the screening, and at the end, 29 interviews were included for the study. And with regards to the qualitative methods, I adopted a retrospective approach with immigrants living in Ontario, that's Ghanaian immigrants living in Ontario. And this gave them the opportunity to reflect upon their lived experiences back in Ghana based on their current living experiences in Ontario. And I oversampled women because in the study context, women are responsible for providing water and for maintaining hygiene in their households. And I must admit that gender here is binary, which is a limitation. So because of the context, we focused on only women and men. So using thematic analysis, we identified different dimensions of gender-based violence. So drawing from the scoping review, we mapped out different dimensions of gender-based violence in the sub-Saharan context. So 4 dimensions of what gender-based violence were identified, including structural, psychosocial, sexual, and physical. And structural violence took the form of political marginalization in terms of who gets access to water, at what time, and price. And these are forms of health denials, and these denials manifested in terms of psychosocial stressors taking the forms of shame, embarrassment, frustration, fear, and feelings of negative identity, even within their living conditions or households. It was also reported that women and girls, because of their inability to pay water service fee, sometimes exchange sex to access water. And there are also instances women and girls were beaten because they couldn't provide wash for their households. And as I mentioned earlier, our framing of gender-based violence as a public health issue is fragmented. We often focus on the physical violence, that is the physical outcome. So using this framework, I have framed gender-based violence as a continuous and evolving process and not just an act or an outcome. And with the framework, we could see how women navigate their context to access water. So here, sociocultural dynamics, that gender roles, social norms, intersect with environmental factors and structural issues to shape gender-based violence in place. But we also realize that individual agency and community mobilization, such as sharing water and lending money to buy water, most times serve as a buffer to women exposure to violence. And all these intersect to shape their well-being. We have to also pay attention to individual factors of constraining issues like gender identity, socioeconomic status, physical ability, and life stage. And in WASH literature right now, our concentration is always on women that are not aged, but the aged too have their life experiences that should be considered. And women over 60 years have cumulative experiences in terms of violence, and these issues shouldn't be ignored. Socioeconomic status most times determine who gets access to water, because if you have resources, you may be able to procure water. But there are also instances that even when you are connected to tap, these taps do not flow. So we realize internally that it doesn't matter whether you have money to get tap connection into your household. It depends on when the water flows. So that is also an important issue that should be considered when we are framing gender-based violence in WASH. Now, place is central in how we frame gender-based violence. And we've learned that the dimensions of what gender-based violence are not mutually exclusive as policy measures are looking at it. Because someone experiencing physical violence will definitely experience emotional issues. But these issues are always considered independently and not collectively. Also, world gender-based violence is shaped by social relations across multiple scales. And based on this, we need to pay critical attention to place in our framing and policy interventions towards gender-based violence. And with this, I wanted to know how gender-based violence or violence sits in place. So I interacted with immigrants, that's Ghanaian immigrants living in Ontario, and I focused on immigrants from the Upper West region of Ghana. Why? Because this context, as I mentioned earlier, is socio-economically and ecologically vulnerable. Ecologically, because Upper West region is within the Sudan savanna, and desertification is creeping in slowly, which is intensifying water insecurity. Economically, this region is one of the poorest in Ghana, which is as a result of historical antecedents relating to colonialism and how post-colonial government continue to build on these pre-existing inequalities. So in terms of WASH, Upper West region is one of the areas in Ghana that is struggling to meet their WASH needs. For example, compared to a national population of 52%, compared to a national average of 22%, about 52% of the population in Upper West practice open defecation. Also, compared to a national average of 70%, about 90% of households in the Upper West do not have access to safely drinking water. And I must admit that most of our participants came to Canada to study, and their least level of education was a bachelor's degree, and a good number of them are professors. So now, how is WASH inequality embodied in space? So interacting with them, we identified different dimensions of violence, which we categorize into 4. And I'll share with you some of their voices. So in terms of physical violence, participants recounted how they experience this dimension of violence in their WASH space. For example, Banayeli, a 32-year-old woman, still remembers how she was beaten by a security man at a mission house, that is a Catholic mission house, which had only one borehole, and that was the only borehole in the whole community. So she told stories about her scars and how this security man beat her and pushed her through barbed wires. And these experiences are still bringing pain and suffering in her mind. There were also issues of psychosocial violence. And here, a participant, Mal Yuri, recounted how he still feels the pain anytime he turns on the tap in Canada to shower or brush. And according to him, it was embarrassing. There were times that he tried supporting the mom to collect water, and he was being teased and called names because it wasn't his role to provide water for the household. And these are some of the gendered issues that I want us to take note of. Sorry, my slide. There were also cases of sexual violence, but these dimensions of violence are not always reported, or participants don't feel comfortable sharing. But some participants mentioned how they heard about a girl that was being raped when she was out to defecate in the night. But there are several literature that also talks about how women were raped or maybe peeped out in their wash spaces. Then structural violence. This is always a slow kind of violence, and it's unfortunate that it's the political institutions that should provide water that most times cause this dimension of violence. And here Maliri again spoke about how the water connection system in their community was influenced by power relations within the community. And households that were rich influenced the directions of these pipe connections. And in most times, poor households had to bear extra cost to buy pipes to get connected to their water system. We also wanted to know how communities or individuals, that's households, responded to gender-based violence in WASH. And most times participants said they didn't get any redress. And I remember one participant asking me that imagine a mouse take his problem to the court of a cat. What would be the outcome? And mostly men are the leaders of these communities, and it's these same men that sit to decide these cases of gender-based violence. And according to her, men are always the abusers. So most times they are afraid to report these cases. And there were instances that even when you report, the police will not do anything, and women get sacked from their matrimonial homes for reporting their husbands of being violent. So some of the key take-home messages are, WASH gender-based violence is multidimensional and reflects an embodiment of place. Yes, I know experiencing violence in the Upper West region will be different from other regions in Ghana. And also, also community responses towards gender-based violence is influenced by existing social structures. And if you don't think this is even violent in the first place, you might not take any measures to address that. And the psychosocial impacts of WASH gender-based violence are not bound to place. And now, living in Canada as an immigrant, have I escaped existing WASH disparities in Ghana? No. And you get to know why soon. We've often framed WASH issues or WASH problems as bounded, but we don't look at how people in distant locations are being affected by local decisions in other jurisdictions. And even we can move beyond WASH and look at what is happening across the world, geopolitical conflicts. We are here, but we look at what is happening in other areas and how we feel. So the aim of this study was to cross boundaries and bring to realities how WASH inequalities are embodied in space and in distant locations. So we conducted this study during COVID, and we frame it within the context of COVID-19. Using relational geographies, we look at transnational relational stress and how that impacts population health. So transnationalism here describes how social connections link immigrants to their home community. And here, migrant sense of belonging is being shaped by the social norms and values in both the host and home community. And within this space, migrants share happiness with their relations back home and also share suffering. And during COVID, we might have had calls from our relatives back home telling us to stay safe. And some of us also called back home, encouraging them to wear their masks and observe the COVID protocols. So through these interactions, we were exposed to the riskscape of COVID in other distant locations. And riskscape here refers to the cumulative perceived impacts of COVID and how we reacted or responded to it in distant locations. And according to Nancy Krieger, our bodies tell stories of how we embody our living environment or our physical or social environment. And according to our participants, their social connections with their families back home expose them to different dimensions of stresses that shape their mental health. So here, participants mention that yes, they still connect with their families back home. They know the situation of COVID back home. And yes, their families were struggling. They needed to help them to avoid COVID infections. So in doing that, they were exposed to different dimensions of psychosocial stresses. And here we are talking of fear of infections during WASH access. And a woman, Vialon, spoke about how she was thinking about her aged parents back home and how they could navigate the COVID restrictions to access water in their community. Though she was in Canada, she had to bear this emotional stress because of her relations and interactions with her family back home. There were also issues of social stresses. And here, a woman soon spoke about how she was insulted and called names because it is believed that she's living in Canada and she could provide a toilet for the mother to defecate. But the sister called her and was saying, it's a shame you're in Canada, but our mom still defecate in the bush. And to her, that was so embarrassing. And she felt less of a human being because of that interaction. Then financial stresses. Our participants also described how they had to adjust their family budgets because they wanted to support their families and friends back home to meet their wash needs or other basic needs during the COVID pandemic. Then stresses related to perceived inequality. Yes, Ghana is a country where politicians use wash provision to campaign, and the institutions that are also supposed to ensure that every household gets connected, in most times creates spaces of frustration, and in doing that, most households are stressed. And here, Fallon, a 40-year-old man, spoke about how he had to struggle to get their house back in Ghana connected to their public water system during the COVID pandemic. So, WASH psychosocial stresses are multidimensional and reflect embodiment of context. And context here could be political, institutional, and it could also be individual behavioral issues. And embodied subjectivities are dispersed across space and time. And we could see that in the voices of the participants. Yes, even though they are living in Canada, they are still embedded in their past WASH space back in Ghana. And long before and even during the COVID pandemic, health geographers have looked at our interconnected in health. And drawing from Angus Deaton, though our participants are in Canada, they couldn't escape their past WASH problems in Ghana. And drawing from Susan Eliot's mantra, all health is global health, and all global health is public health. Yes, COVID pandemic was a global public health issue, but because our participants were embedded in two transnational spaces, they had to experience how they will handle their COVID issues in Canada and how they could also support their families back in Ghana to meet their WASH needs. Looking at all these issues discussed, how do we frame up WASH gender-based violence or WASH inequalities broadly? Recently, research on the role of place in shaping gender-based violence is localized. We often look at context compositional arrangements, and by compositional, I'm talking about how we focus on individual socioeconomic status, demographic issues, and individual behaviors to frame WASH issues in one locale. Contextual issues also talk about the fact that our neighborhoods shape how we access water, at what time, and the price. Yes, we know water has color in other contexts. That is, in US, if you are looking at the Flint water crisis, we also know water has a color in Canada. That is our backyard, looking at indigenous water crisis. So if we focus our discussions at compositional and context level, we might miss the big picture. That is how macrostructural factors shape WASH inequalities and how these inequalities get under the skin of individual as a form of violence. So as I mentioned earlier, WASH gender-based violence is a form of health inequality produced and structured by political, economic, social structures, and that is systematically embodied. So to scale up the analysis of what's gender-based violence, we have to look at the different skills based on the framework I introduced earlier. With this framework, yes, I will be able to understand the lived experiences of my sisters, how the community experience was gender-based violence or was inequalities, and how these inequalities are being sanctioned by institutional decisions and policies at the regional or national level. And most times, the individual or macro level is always a site of struggle. That is where individuals experience the decisions that are being taken at the meso and macro level. And at the macro level, we have to pay attention to social norms. Yes, we've realized in another study that though our participants live in Canada, they still scrub their washrooms. But when they get to Ghana, they are not allowed to scrub these washrooms because they are men. And most times, it's women that ensure that everyone live in their social or prescribed spaces. So how do we navigate these social norms that normalizes gender-based violence and reconstruct these dimensions of violence for policy interventions? And the macro scale, these institutions are supposed to facilitate access to WASH, but these are the same institutions that mete out violence to deprived communities. And it's surprising that sometimes people experience inequality to the extent that they normalize it. They think, yes, it's because of poverty, but they don't know that this is something that is being sanctioned by their political decisions. So we have to create conditions for WASH insecurity, and understanding these conditions will be able to take policy decisions. And for an institution like UNWEH, we need to be deliberate in how we communicate these dimensions of vulnerability. And this is the time for us to move beyond looking at representation and focus on integrating different voices in our world policy decisions. And these are issues we are discussing, and our director is doing so well in championing some of these discussions. So now I'll end the discussion here, and I'm ready for your questions. Thank you so much for your time. And I must add that Professor Susan Elliott highlighted some of these findings in her talk in March, and I encourage you to look at it for more discussions. Thank you so much, and thanks for your time.
Thank you so much, Dr. Nunbogu, for a really fantastic talk and really Thank you so much for a really powerful talk. And thank you also for putting the QR codes for your research. I encourage our viewers to read the papers. I think particularly your paper about COVID and bringing all of this home. I want to first start by asking you about the role of these socially prescribed spaces like water collection points and these kind of gendered non-neutral places. And I'm wondering what recommendations you might have for how communities could begin to transform these spaces for a positive way, and how might we be able to help people reclaim this dignity in places like water collection or increase safety, particularly for women and girls, as you mentioned. Oh, you're muted.
Thank you so much for the question. I think we need to focus on social norms. That is an important area we need to deconstruct and maybe demystify. And people should be made known that a man can collect water, a man can scrub a washroom if you have the time to do that. And yes, as I mentioned earlier, the Upper West region is highly patriarchal society, but interacting with our participants here that you realize exposure sometimes deconstruct some of these social norms. Yes, I was privileged because it wasn't my role to provide water, but that has changed now. At home, I scrub. The washroom, I support because I feel it's a collective responsibility. So beyond demystifying some of these social norms, we have to also look at how we frame our water problems. It's not just about providing the borehole or getting connected to the tap, but these communities should be sensitized, and behavioral change campaigns should be championed in these communities so that these dimensions will be unraveled. Yes, most times they don't see. Maybe it's normalized that a woman should provide water. But if the other part of the story is being told, behaviors could be changed. Thank you.
I also want, I really appreciate that you began by talking about your own lived experience and that of your sisters. And I think it's also impacted the way, the way I see things now, just working with you in the short time that you've been here. And I'm wondering if you could talk a little bit more about how you initially got into this research area and whether your lived experience is what led to this in the beginning.
Oh, thank you so much. So I'll start by saying, yes, I've worked with NGOs back in Ghana, and that exposed me to this space of WASH inequalities, where I've witnessed communities drawing from rivers to drink, communities defecating openly, and these communities, even after sensitization, didn't want to construct latrines because they feel that an adult and a kid could not share the same latrine. Then I met Professor Susan Elliott, who sowed the seed. Initially, I wanted to work on livelihoods, but she said, oh, this is a good area for you to look at. And that seed germinated, and here I am today. So I would say it's based on my lived experience growing up in the Upper West region and also meeting a wonderful advisor as Susan Elliott. Thank you.
Okay. When you see me this restless, it's because there's so many things going on in my head, and I'm wondering, how do I approach this? Because I don't know. I'm searching for the right words to really frame my reaction to this. Not because I'm unfamiliar, of course, I'm well familiar with all this, but also try to move above the depressing nature of the issue to creating a forum for more constructive and positive way out of it, But maybe I should start by saying, picking you up on the quote, we should move beyond representation to integration. That's strong, that's powerful, and I like it. But I also want to pose the teaser back to you. Can integration be achieved without representation?
I would say no. And why am I saying we need to move beyond representation to integration? Over the years, growing up, I've witnessed my mom participating in community WASH meetings, but the problem hasn't changed that much. We've witnessed community activists advocating for women engagement or women involvement in WASH. And we shouldn't be looking at the numbers. Why am I saying we shouldn't be looking at the numbers? Sometimes I feel it's just too involved to maybe meet a criteria for funding or for face cover. There are instances where women are even beaten for joining community meetings. And there are instances where women are relegated to the background because they weren't allowed to sit in community meetings. So now, even after engaging women, after involving them, we need to integrate their voices in our policy decisions. It's not enough to get them involved, but listening to their voices, paying attention to their silences, because we know when a woman is in pain, most times they don't talk. And sometimes this silence is definite enough to tell us that this is the issue we should look at. So let's involve them, but we have to also pay attention to their individual experiences. Let's pay attention to their voices, and then we can make informed policy decisions.
Okay, thank you for that. Thank you for that response. So I know the first place to start is representation. Then we now move from representation to integration. Point well taken. But another big issue for me is, luckily you are a male gender, and also luckily for me, I'm a female gender, and we share similar backgrounds, in terms of lived experiences. So now I want to zero in, based on that context, I want to zero in on this issue of social norms. I've been a strong advocate to the notion of performative actions. Social norms are perpetrated by performative actions. It's because we keep doing it, in terms of repetition, in terms of, just we keep doing it. Okay, that's the way it's been done, and we keep doing it, moving it forward. That's the way it's been moving forward. But there is an event, just a couple of days ago, actually, that happened in Nigeria and triggered, something that got me thinking. One of the famous obas, traditional rulers, is called obas in the southwest Nigeria, died. And I saw an essay of how that particular oba changed an ingrained tradition. He was abroad when he was approached that it was his turn to become a traditional ruler. A lot of people will run away from that because of all the, traditional practices around it. One of them is mutilating a traditional ruler when they die. And in fact, killing the most loyal servant to the king. So in other words, the most loyal servant, that the servant, like a PA that served the king, the moment the king dies, he knows his life is also, they die together, something like that. So he had worked seriously to ensure that, in fact, constitutionally, that practice be revoked. Maybe because he knew that now that he is becoming an oba, at a point when he dies, his own body parts will also be mutilated. And, there was this strong, essay, they now chronicled his activities to changing that. So that got me thinking. That's one deep-seated traditional practice that you would have never thought would have been changed. And they actually passed a law to that regard, that every traditional ruler going forward must be buried according to the faith they profess. So if during your reign you claim to be a Christian, for instance, when you die, you will be buried, in Christian tradition, not in traditional, traditional practices, or whatever religion you claim, Muslim or something, and they got that done. So that got me thinking. So this idea of social norms, these, deeply seated traditional practices, can really be unseated, especially when we know, and some of the things they cited was now killing is criminal, is unconstitutional, so that in the secular world, legally, killing someone for another, that those practices are wrong, they're legally, wrong, and they were changed. Now, bringing that into wash, this idea of it's only women and girls that must fetch water, what can we do to have that deeply ingrained practice that is not bound, as you have said, by space or time. You know, it's happening everywhere. What can we do fundamentally to get this report?
Thank you so much. I have to add that, yes, in some contexts, boys collect water. And now back to the question. You see, we need strong leaders. And by strong leaders, I'm not referring to the physical strength, but how these leaders can navigate these social cultural structures. Yes, he was a king. And I know for over years, individuals at the community level weren't happy with these social structures or social cultural practices, but maybe they couldn't do anything. So we need leaders that can champion, reason with the people, think through some of these bad practices. Yes, maybe it's not bad, but maybe viewing from Canada, I think it's not okay. So I'm selecting my words carefully because people's culture should be valued and their norms should be valued. But in terms of WASH, we need strong leaders to rethink some of the decisions that we make and influence change. Yes, this is not related to WASH, but I know there are also strong cultural practices that I have witnessed because there was this community, as I mentioned earlier, they said an adult and a kid could not share a toilet. But with several interventions, several sensitizations, we had to involve other traditional leaders, organize seminars and workshops. Now, that community constructed latrines. That was in 2010. So, yes, if we are determined, if we frame the problem well, we can solve it. But just telling them it's not good, it's not enough. We have to demonstrate why it is not good. Thank you.
Thank you.
We have some questions in the chat. Dr. Ramchandani says, thank you for a very interesting presentation, Dr. Nunbogu. I've recently been reading The Body Keeps the Score by Bessel van der Kolk, in which he discusses how trauma can be embodied, not just psychological events, but living in the body, affecting physiology, immunity, neurology, etc., also impacting self-perception and agency. You shared how the act of seeking water or accessing water, even in different contexts, may reinforce trauma pathways described by van der Kolk. Have there been any exploration of how unsafe WASH environments might perpetuate embodied trauma among gender-based violence survivors? I wonder what trauma-informed principles might be applied to the design of WASH environments. Would love to hear your thoughts on this.
Yeah, that is an interesting question. And I think some of these issues came up in our studies, but I'll start with a study in East Africa that highlighted that in areas of water insecurity, gender-based violence was highly reported by participants. And we've also realized that in contexts where women had to struggle to fetch water, issues of emotional stresses were high. And yes, we often look at one dimension of it, but in the long time, these issues are embodied and that change human physiology. And there are other studies, even outside WASH, that highlighted how stresses could lead to miscarriages, could affect women functioning as a woman does their biological functioning because of stresses. And we've also looked at how violence, not in WASH, violence in general, sometimes lead to non-communicable diseases in later stage of women's life. And we observe that, yes, if a woman is exposed to violence in her early life stages, by age 40, that woman is most likely to develop hypertension. And most times it's the emotional violence that we underlook, but is that form of violence that in most cases exposes women to these non-communicable diseases. So the question asked is relevant. There are other studies that highlighted it. And to me, we have to step beyond looking at the immediate impact and look at some of these late stage effects of war gender-based violence. Thank you.
I want to pick up on what you talked about how health is relational, and in your COVID study highlighting that it's not just individual, but it's shaped by our community, by our family, and even local changes in accessibility of water really tie into deep, roots of immigrant populations. And I really like the quote that you had, that all health is global health. From your perspective, how do you think we can better incorporate these interconnected layers, the social, spatial, transnational, into our public health responses, especially for migrants who are facing water insecurity across borders?
Yes, so we have to first frame the problem. And I have mentioned this severally. If we know that as a migrant in Canada, your health is not only being shaped by you being in Canada, but your health is also shaped by your connections back home, then we know that this migrant might not be healthy if the relatives are not healthy. And as a migrant in Canada, you first have to juggle accessing health insurance, which I know many migrants are excluded, though Canada is supposed to be a country with better life chances. Most migrants are struggling to get health insurance. And handling that, we shouldn't exclude that aspect of their life from their WASH experiences. That is how they relate with their relatives back home. And let's look at WASH from the system perspective. We should move beyond looking at someone having a tap at home and saying the person is water secured. How does that person access water? And there are cases where even in households with access to tap, some people don't get access to water because they cannot pay the fees. So let's look at it from the system perspective. Yes, not having access to water will not only expose you to maybe diarrhea, but it can also affect your emotional well-being and the people around you. So in short, I think we have to frame the problem broadly across skills, then we can make decisions towards resolving them. Thank you.
Wondering from a policy perspective, just starting with tackling the simplest aspect of the problem, which is still really complex, what would you recommend as an intervention in the case of COVID to increase access to water? Are there any specific policy or regulatory changes that you think could work in this context?
Yes, and I will use the context of Ghana. During the COVID-19, the government of Ghana instituted this program, Free Water for All Households. So public tanker services were providing water for free, though there were certain challenges, and the public tap system was free. Yes, that helped to some extent, but post-COVID is no more. So if we know that during COVID, people needed water to survive, they still needed water to survive post-COVID. So it means we know the problem, water access is a challenge. And we have to also look at individual differences. I think this is something Professor Oluwasanya highlighted in her science talk. We have to look at individual differences. Women are not the same, individuals are not the same. So if we look at individuals as a homogeneous entity, we will miss most of the inequalities. Women in their late stages, that's older women, experiences or WASH issues differently as younger women. For example, in some households, this older woman will sanction the younger woman to provide water. But in other households, this older woman will have to fend for water on their own because they are independent. So we have to look at all these dynamics. And the context of COVID provided a good foundation for us to painfully see all these dynamics at play and take policy decisions. Thank you. I don't know if I answered your question well.
Okay, what will be your message to the, I'm trying to choose my words carefully, like you say, male gender? What should be their role in this? Because like you said, also from your lived experience, you did enjoy that wash infrastructure immunity, privilege, So what would be your message, to the male gender that have enjoyed, to a large extent, this kind of privilege for so long?
Well, I'll say water is a collective responsibility, in short.
Thank you.
Thank you.
All right, you can wrap up.
Okay, yeah, I'm interested to hear what your next steps in this research are. This is a really fantastic presentation.
Thank you so much, Miriam, and thank you everyone for joining. I appreciate the opportunity.
Yeah, thank you.
Thank you so much, everyone, for joining us, and we will see you next week.